Here we have a first responders kit. In the front upper pocket we've got a BGL kit. We've got BP cuffs for both paediatric and adult. We have a stethoscope, a pupil torch, a thermometer and clothing shears. In the front lower pocket we've got PPE gear such as glasses and a face mask. We've also got extra glucose and a pad. In the large side pocket we have everything we need for hemorrhage management. We've got two tourniquets, some tape, saline, different size gauzes and different size and shaped bandages. And around here on this side, in the front upper pocket, we have a sick bag, a spinal lanyard, and spray-on anaesthetic. And in the pocket underneath of that, we have everything for glucose management. We've got a giving kit, we've got a needle and a syringe, extra glucose and extra glucagon, and we also have oral glucose. In the big pocket here, we have medications such as Panadol, Tramadol and ibuprofen. We also have a Penthrox inhaler, also known as a green whistle. In this pocket here we have a biohazard bag. We've got a laryngoscope, we've got our OPAs, our NPAs, our forceps, adult sizes, and we've also got lubricant. In this pocket here we've got a nebulizer, and we also have oxygen tubing, and in this one here we have medications such as adrenaline and salbutamol. On all medications, making sure to check that we have ones that aren't expired and at least 10 of them in that one. In the big pocket here we have a towel, we have a hazards container, we have several slippery sands, we've got our IV lines, extra sodium chloride saline rinses, we've got a IV giving set, we've got our LMA, we also have our adult and our paediatric bag valve masks. Over here we have some cardboard splints and a neck brace. This is an oxygen cylinder. To identify it, you've got a black top with a white cylinder, and it says either oxygen or medical air on the front of it. First of all, we're going to check the Botox seal, taking off the regulator, hooking a finger under and taking off the seal. In this case, there are no tears or marks, so we can go ahead and put the seal back on. And then to attach the regulator back to the bottle, we're going to get the two prongs from the regulator and line them up with the two holes on the oxygen cylinder. Once that's nice and tight, I'm going to check the pressure of the oxygen bottle. By doing that, we're going to turn on the bottle, and normally the gauge would shoot up and hopefully sit in the green area, meaning the bottle is full and pressurized. However, in this case, this is an empty bottle due to it being a demonstration bottle. Several different masks use the oxygen bottle. Each mask is attached in the same way. However, all masks use a different flow rate. So, for example, a nasal prong would use a flow rate of 1 to 6 litres per minute, a nebulizer would use 6 to 8 litres per minute, and in our case, a bag valve mask is going to use 15 to 25 litres per minute. So we're going to attach this by popping that on there, making sure it's on nice and tight on both ends. We're then going to turn the flow rate up to 15 in this situation. Once that is finished, we're going to turn the flow rate back down to 0. We're going to turn the oxygen bottle all the way off. I'm going to gently take this off, and then we're going to bleed the regulator by just turning the flow rate back on until all the oxygen is bled out of the regulator, and then turn it back off. The oxygen bottle must be lied down for safety and kept as close to the floor as possible, and when it's on an ambulance, it is going to be attached safely and securely to the wall. This is a suction unit, and in order to test that it is working, we're going to turn it on full and occlude the tube and wait until all the lights light up to show that suction is working. As you can see there. And as you heard, that is the suction going through, showing that it is working. Another way you can check suction is if you cover the hole and just suction up your glove then. When you're using it on a patient, you want them to be lying on their side, and as you put it in, you want to put it in only as far as you can see, and then you're going to cover the hole and in circular motion slowly pull it out for no longer than 10 seconds. Complications that come with using a rigid catheter include induced vomiting, facial nerve stimulation, soft tissue damage, and laryngospasms. Rigid catheters aren't used on ambulances because they're moving in conjolt, and they also aren't used on conscious patients. You would use a soft catheter for kids and going up their nose otherwise. This is a Life Pack 12 defib. So to start off with, I'm going to check the paper by opening up this tray here. And as you can see, there's plenty of paper to last us a shift, so I'll go ahead and close that back up. Next, I'm going to turn it around and check the charge on the batteries. To check how much charge is in the batteries, I'm going to press both buttons there. And as you can see, that one's got 2 bars and that one's got 4. If it were flat, I'd just hook my finger in there, take it off, and swap it with a battery that is fully charged. So first thing I'm going to do is I'm going to turn our Life Pack on by pressing the on button. Next, I'm going to turn it into manual mode. So to do this, I'm going to press advisory. Using our selector knob, I'm going to go across, select yes, and press yes. Next, I'm going to do a user test. So to set that up, I'm going to press options. Using our selector knob again, I'm going to go until it's highlighted user test and press OK. And while the user test is running, I'm going to go through the 2 pockets. So I'm going to start in this pocket over here where we have our entitled CO2. So our entitled CO2 measures the amount of expired carbon dioxide in our body. Next, we have our SpO2 sensor, which reads the amount of oxygen saturation in our blood. And after that, we've got our adult-sized BP cuff, which measures the blood pressure. And then last but not least, we have our ECG, our 3-lead ECG. Often you'll have a 12-lead in there as well, but in this case we don't. So I'll go ahead and light it there. And then in our next pocket over here, we have all things defib. So to start off with, we've got our defib pads, but in this case we're going to be using nodes as this is a practice dummy. I'll light that there too. We've got our main cable here with our test slide. And also in there we have a razor, we have aspirin, we have GTN, and that's often where you find spare paper to our printer. So I'm going to rip off our paper here, and it said our user test is passed. So for now I'm going to pop that on the side over there. Next thing we want to do is we want to set up our test load. By doing that, we're going to plug in the test load to our main cable. Then we're going to go charge. And we're going to wait for that to charge, and so it says press shock, so I'm going to go ahead and press shock. So shock has been delivered. In any case that you're going to charge it and you want to cancel shock, so we've got charging, you want to cancel it, you're just going to press the selector knob there. So what I'm going to do next is I'm going to take off the test load and I'm going to plug in our defib nodes. I'm plugging in our defib nodes. We're going to plug one on the side there and up here on our chest. What I'm also going to plug in is our 3-lead ECG, and with our 3-lead ECG we've got one on each leg and one on each arm. So I'm going to put one down here on the right leg, one over here on the left leg. We're going to go right arm and up here on the left arm. So what we're going to do now is we're going to change the view of our screen by pressing lead, using the selector knob to go down to 2, 1, 3, pressing OK. And we're also going to change the size by pressing the size button, using the selector knob to select the big size and pressing OK. What I'm also going to do next as well is I'm going to turn the selector knob until it highlights the heart rate volume, press OK again, turn the volume all the way up and press select. And we're going to go to the home screen. So what I want to do now is I want to press analyze and let the defib and the 3-lead ECG go.
No shock advised. Start CPR.
So that is our Life Pack 12. We arrive on scene to a 65-year-old male collapsed on the ground. Looking around, there are no obvious hazards or dangers. Our stretcher is parked here for ease of access. He looks visibly pale and doesn't look to be breathing. Maddie, this could be a resus situation, so can I get you to set up that AED in the suction unit when we get in? Thank you. Here we go. Hi, sir. My name's Hannah. This is Maddie. We're from the ambulance. Can you hear me today? Can you open your eyes for me, sir? All right. No response to verbal stimulus. I'm going to try pain. Excuse me, sir. Can you open your eyes for me? My name's Hannah. Hello. All right. No response to pain stimulus. I'm going to do a head tilt chin lift to check his airways. Airways are clear. I'm now going to listen, look and feel for a breath for 10 seconds. Alright, Maddie, he's not breathing. Can I get you to start compressions, please, while I start defib and call for backup? AUT to comms requesting an R50 backup.
Analyzing heart rhythm. Do not touch the patient.
Alright, Maddie, hands off, thank you. While we wait for that, I am going to set up the bag valve mask.
Shock advised. Starting. Stay clear of the patient. Deliver shock now. Press the orange button.
Stay clear.
Now. Shock delivered. Pause. Start CPR.
Cool, Maddie, I'll get you to continue while I insert an OPA and an NPA. I'm going to start off using an OPA. So for OPAs, you're going to measure from the corner of the mouth to the corner of the jaw. Then I'm going to go in backwards, rotate 180 degrees to move the tongue, and that will pop in there. You wouldn't use an OPA on patients who have trismus, who are seizuring, or who are conscious, and it can cause soft tissue damage. I'm going to apply some lube and for the NPA, and I'm going to measure from the corner of the nostril to the earlobe. And then I'm going to find the biggest nostril, make sure it's curved downwards, and I'm going to apply it straight down. If you have trouble, just give it a little bit of a rotate. You wouldn't use an NPA on a patient who has facial fractures, a possible TBI, or a blood nose. This can also cause more trauma or soft tissue damage. I'm now going to insert my my bag valve mask into the oxygen. I'll plug it in there, turn it on. I'm going to put the flow rate up to 15. For the bag valve mask, I'm going to be using a CE grip, and I'm going to be squeezing 1/3 of the bottle every 2 pumps. Maddie, can I get you to count down from 5 for me, and then I'll get you to pause. 5, 4, 3, 2, 1. I'm going to squeeze the bottle, going 1/3 of the way in. Thank you, Maddie. Continue. Problems with the bag valve mask is if there is facial hair, it can stop from getting a good seal around the mask. Possible reasons you wouldn't use a bag valve mask is because of facial fractures. You also wouldn't use PEEP in this situation. Thank you, Maddie. You're doing a very good job. Keep it up. I'll give you a rest in a moment.
Stop CPR.
Right, Maddie, hands off. I'll get you to swap with me. You're looking a bit fatigued.
Analyzing heart rhythm.
I'll get you to count my compressions for me, Betty. And after 25, can I get you to count out loud for the following 5? And then I'll pause for you to do breaths.
Pause. If needed, start CPR.
Cool. Ma'am, were you in the room when your husband collapsed?
No, I was in the garden.
Alright. Is he on any medication at the moment?
No, he's not.
And allergic to anything?
He has hay fever, but not often.
Thank you. 5, 4, 3, 2, 1. What was he doing prior to the accident?
As far as I know, he was inside watching TV.
Alright, thank you. I'm now going to continue CPR until either the patient is revived or backup arrives. 5, 4, 3, 2, 1. Thank you, Maddie. You're doing a wonderful job. When performing CPR, we're going to go 1/3 of the patient's body depth, making sure to come up all the way so the lungs can reflate themselves. 5, 4, 3, 2, 1. Yep. 5, 4, 3, 2, 1. Thank you, Maddie. You're doing a wonderful job. Keeping a nice CE grip there.
Stop CPR.
Hands off.